Welcome back to the Chad Hasty Show, News Talk 95.1 FM, 790 AM KFYO. Joining us to talk about how all this is impacting the great state of Texas, our good friend Scott Braddock, editor, Quorum Report. Normally we hear from Scott on Mondays, but I was off yesterday, so we get to visit with Scott.
Were you social distancing, Chad?
I was, absolutely.
Yeah, and are you and Jody separated by glass?
We are separated by glass and Lysol bombs.
Okay, very good.
Yeah,
I think you're doing it right. There's no other way to do a radio show, I guess. I heard one podcast this morning where one person was in studio and another person was in their basement. They were doing it remotely that way. Because of coronavirus, here in Texas, we have 57 confirmed cases so far. We have the governor saying that by the end of this week, they should be able to test more than 10,000 people for COVID-19 per week going forward. But look, we don't have our minds around exactly how this is impacting the great state so far. There are 30 million people in this state, right, roughly. And I don't think that when they say there will be 10,000 tests per week available going forward, the governor's saying that everyone who needs a test is going to get a test. And technically, he may be correct, Chad. Not everybody needs a test just because they think they might have it.
Right.
They're going to need some indication from a physician that they actually are, that they're showing symptoms of this disease. Of COVID-19, but I don't know that the 10,000 number is going to put people at ease, right, because of everything they're hearing. You heard what the president said yesterday in his press conference, which was that people should not gather in groups of any more than 10, which was down from the day before when the CDC had said that people should not gather in groups of more than 50. Right? And the reporting this morning indicates that the reason that the president and the advisors to him have, come out with this really strong recommendation of less than 10 people getting together is because they were looking at a really dire report internally in the White House that showed that if there isn't swift action by the government and by individuals here in Texas and all across the country, that 2.2 million people in the United States could die from this disease. This is unlike anything we've ever seen, Chad. In my 20 years of doing news, I have covered hurricanes on the Gulf Coast, wildfires on the West Coast in California. I've covered the fallout from 9/11. This is somewhere in between what I would say it's either a slow-moving 9/11 or a fast-moving drought. Right, you'll all know about it in West Texas. A drought has, serious economic implications. Livestock, passes away, and all of that. Billions of dollars can be cost to the state of Texas. Can be the cost of the state of Texas from a drought. This is much faster than that, much slower than the shutdown after 9/11. Somewhere in between it, a slow rolling disaster that has real implications for people's lives and for the economy. Down in Matagorda County, we had our first recorded death from coronavirus. It was a guy, I'm told, who was pushing 100 years old. He was in his late 90s. So that's an indicator of what we've heard so far, which is that the folks who are in the elderly population are the most susceptible to be killed by this disease. And the whole question about younger people like you and me, sort of social distancing is the word you're going to hear over and over again. How about not using that because it sounds weird? How about just saying being on your own? I saw one of the, and by the way, we shouldn't, suspend humor during this time. I think you have to take it very seriously, but if we can't laugh, we'll all cry about it, right?
Yeah, there has to be a little bit of entertainment out there.
People were saying that, if you want to drink a quarantini at home, that's fine. It's just a regular martini. You just drink it alone by yourself in your house.
I like
so,
that.
So quarantine cigars, et cetera. For you and I as cigar smokers, I would say that a lot of times we're social distancing just by lighting up because people don't want to be around us, which is, that's always fine. But look, a very serious deal in Houston and Dallas. They have already said that the bars and restaurants have to shut down. It's takeout only or delivery only from those places. And in Austin, I'm told there's an 11 a.m. press conference coming up with Mayor Adler. We'll see what he has to say about it. So far, they haven't done a similar shutdown here in Austin, but that's what I would expect.
I would imagine that 6th Street is going to be pretty empty for a while.
Yeah, that's right. And by the way, if they don't do something like say that those bars have to shut down, there probably would still be a lot of people who would head out and try to celebrate here on St. Patrick's Day. I mean, I've got my green on, it's just nobody can see it because I'm all alone.
Yeah, it's and Scott, I think that the governor was right, and it was an obvious point that he made that once we start seeing these tests go through, and if that number is real, the 10,000 people a week can be tested, I guess at the end of this week, they'll have that capability. The numbers are going to go up. There is a thought out there that this has been going around, that this has been out there for who knows how long. We haven't had a test for it. We haven't really known much about this. And so we probably will see the numbers spike dramatically.
Yeah, the governor said, don't be surprised if the numbers go up exponentially. But to your point, if you're flying blind and you have no idea how many people may actually be carriers of this, how many people may be exhibiting symptoms because the tests haven't been done and then confirmed, then, the numbers are going to go up because there's more transparency. There's more clarity to the system. And you'll be hearing this phrase over and over again, flatten the curve. This is actually not a new idea when it comes to healthcare. It's just something that we're all talking about now. The idea that if people who are young, and this is a way to think about it, people who are young who may be carriers and might get the disease but would not die from it, they would just be sick for a while. The issue is that you have a responsibility to not then turn around and give it to somebody who could die from it. One of your elderly relatives, for example, is somebody who might be more susceptible to passing away. And I'm not comparing it to the flu. I think that's not exactly what people ought to do. But we know that there are folks who are also susceptible to dying from other diseases because they also have some other underlying condition. And so caution is the word of the day, and we'll get through this. I know there's a big argument out there that, if you suspend all this economic activity when it comes to restaurants, bars, hotels, et cetera, that you're doing even more damage to the economy. But we don't have a structural problem within the economy that's causing this meltdown. It's not like 2008, Chad, when you had people who were basically selling securities that were worthless. So you know the deal. Yeah. It's because people were not able to, make the notes on their houses, and they were not paying their mortgages, and those worthless mortgages were being bundled up and sold to people. That was a structural issue within the economy causing that. We don't see any evidence of that now. So it's not a structural issue.
Well, I think
in the economy, it's an external problem that's attacking the economy.
Yeah.
Meaning that if we turn it back on in a couple of months, after this 8 weeks or however long is over, everything should kind of go back to normal. In the meantime, they have to figure out where all these other people go. You may have seen that Amazon, for example, is ramping up and saying, it was in the Wall Street Journal this morning, that they're going to be hiring 100,000 workers across the United States because the economy is shifting. People are staying home, so they're ordering things online. And, of course, at their fulfillment centers, they need more people.
Well, and I think what... the economic concern, and I get the economic concern. Obviously, here in radio, we've got a lot of businesses that are concerned, and I think we get that. I think it's a two-part thing, which is the local governments are working faster than the federal government as far as doing these shutdowns and telling the restaurants to close. And if you were a restaurant employee, well, then Scott, you're worried about rent, you're worried about mortgages, you're worried about that. That's coming, it seems, maybe from the federal government. They're going to address that. There's just so much unknown. And I think that is what is freaking everybody out. The unknown that, okay, if I work at a restaurant, if I'm a server, if this does last till August, let's say, if this lasts till July, if this lasts best case scenario till May now, how am I going to pay rent in May? How am I going to pay rent in it? And I think the federal government's going to have an answer for that. At least it seems. Let's move on, Scott. As far as another answer that we have, and I think families are happy about this. I think educators are happy about this. Schools are happy. We have unity. The STAR test is being waived.
Yeah, the governor yesterday said that the end-of-course exams and STAR exam, that the requirements for that are being waived this year. This is being done at the same time that Betsy DeVos, the education secretary, told Kevin Brady, who turned around and told us at Quorum Report, that the education department is going to have, by the end of this week, and that's how quick things are moving, Chad, by the end of this week, states will be able to apply for waivers such that under the Every Student Succeeds Act, which is the federal legislation governing all this, that they'll be able to apply to not have to do those standardized tests all across the country under the authority as it is written in that statute. The education secretary can't just say in a blanket way that the whole country, for every school all across the nation, that they don't have to do the standardized test. She can't do it that way. But it does sound like because of the spread of the disease, they probably will end up, the net effect will be that every state will probably get a waiver because this is what's happening in schools all across the country. I mean, there's a big question right now. We're looking into this at quorumreport.com. What is really going to happen with schools? We're coming close to the end of the school year here anyway, and spring break is being extended all across different school districts. It's true for the school that my daughter attends. Do they even come back this year? I think you had asked that question on Twitter. And I think that at the local level, at the state level, they're discussing that right now. And there would be a way, Chad, to simply take the end-of-course exams that they've already done, for example, back in December, and take those and have those count for what the kids, what their scores are going to be. The last thing, and I think Republicans, Democrats, liberals, moderates, everybody in between, we've talked about this before, every sitting member of the legislature has heard this from constituents, that the kids take too many tests. And so I think there was broad support for it, across all different constituencies to just set that aside. It's good news. The last thing that the schools and the parents need to be worried about is standardized tests. We do have local ISDs all over the state right now trying to figure out how to help provide, meals for kids in Houston and Dallas. I've seen different school districts in those areas, stepping up with, food distribution programs right now because some of those kids rely on the breakfast and the lunches that they get, and they can't not have those in the meantime because of the economic situation for the parents. And in a lot of cases, and this is certainly the case in West Texas, the school district can be the center of the community in a lot of these towns and a lot of these communities. So they're still stepping up to help the students in a lot of different ways, and it's the health of the kids that comes first, safety of the kids that comes first, and thinking about a damn test, that ain't it.
Yeah. Scott, we got to get moving. When we get you back on Monday, we'll talk about the continued fallout because we've got state conventions that have been moved.
Yes.
We've got, the idea about voting coming up in May elections and runoffs and everything else that is evolving in Texas. So it's a story that's going to have an impact on everything moving forward here in the state.
Someone was saying this just the other day. I've never seen it where political reporters, healthcare reporters, economic reporters, et cetera, are all covering the exact same story. There's so many different angles to it, and we've got the state government side of it covered for you at quorumreport.com. All
right. Scott, as always, appreciate it. Stay healthy, my friend, and we'll visit with you next week.
Same to you, Chad. Talk soon.
All right. That's Scott Braddock, editor, quorumreport.com.